Let me introduce this morning keynote speaker by saying a few words about her. Ms. Seileen Mullen has spent nearly 30 years working in support of military health and is currently serving as the Acting Assistant Secretary of Defense for Health Affairs in the United States. In that role, she is the principal advisor to the U.S. Secretary of Defense and the Undersecretary of Defense for Personnel and Readiness for all Department of Defense health and force health protection policies, programs, and activities. Ms. Mullen has had a distinguished career supporting significant federal government endeavors, including the management of the TRICARE contracting activities, serving within the House of Representatives and as a staff on the House Armed Services Committee, and being selected as the Director of Federal Government Relations for the Salt Lake Organizing Committee for the Olympic Winter Games of 2002. Tout au long de sa carrière au sein de la fonction publique, Mme Mullen a été une championne de la prestation des soins de santé et sa présentation abordera certains de nos objectifs partagés pour assurer la santé au long terme et l'efficacité opérationnelle des femmes en service. Please join me in inviting to the stage with a warm Halifax welcome, Ms. Seileen Mullen.
Good morning, everyone. Let me get this ready. I am truly honored to join you here today to share some perspectives on women's health equity in the armed forces and to hear from you as well. I'd like to begin by first recognizing the unique relationship between the United States and Canada, one of the closest relationships between two nations on Earth. We share the world's longest international border and trade more than $2.5 billion a day in goods and services. The defense arrangements we share are the most extensive that the U.S. has with any other country. We share collective defense commitments within NATO, of course, but many people don't know that we cooperate on continental defense within the framework of the North American Aerospace Defense Command, NORAD, which is the world's only binational military command. Our respective strategic approaches to the challenges of the world today are aligned, whether we're looking at national security, climate change, or human rights. Demographics within the armed services of our countries are very similar. We both employ an all-volunteer force. 16% of the Canadian forces are women, and we are about 18%. We are both committed to increasing the representation of women in our force, understanding the strength a more diverse force brings to the challenges at hand. So, what do we mean by women's health equity, and why is it important? Health equity simply means that everyone has a fair opportunity to achieve and maintain their highest level of health without regard to gender or race or socioeconomic status. Achieving health equity requires focused effort to understand and address historical and current barriers to health equity and create processes that overcome those barriers and work to eliminate preventable health disparities. The goal of health equity is important on its face from a standpoint of basic human rights. Within a military context, though, added to the basic understanding is the fact that health equity is a readiness and military capability issue. As we increase the percentage of women in our armed forces, we must make sure that they have access to the healthcare resources and tools they need to fully realize the contributions they can make to national security. In the U.S., women are the fastest growing population in both current military service and among veterans. We understand the critical importance of ensuring their specific healthcare needs are met through health policies and delivery. Optimizing the health of the women in our force is critical to individual and unit readiness, retention, and the overall well-being of each woman serving. Knowing this is a common goal between us, I'd like to share with you a few of the initiatives underway in the U.S. military to support this imperative. The Women in Service Working Group is a multidisciplinary group with representatives from each of the individual military services at the Department of Defense. Members are selected for their overall experience in healthcare and in personnel administration. The group was formed to address key issues facing women in the armed forces and answers directly to senior Defense Department leaders. I'd like to emphasize the importance of this reporting relationship. Direct access to senior leaders is important both to effect real change and to demonstrate how serious we are about this challenge. One of the key drivers of this group is to streamline efforts within our Department of Defense and provide clear accountability. The Military Women's Health Research Consortium develops and guides best practices for the clinical care of women in the military healthcare system. The consortium's charter is to identify priorities that use novel and well-defined methods in the areas of personalized medicine and population science and focus on basic, clinical, and translational research of particular relevance to the military health system and address key interests for women's health. Some of the consortium's recent efforts include studying interventions for physical and emotional pain due to uterine fibroids, evaluating disparities in treatment of women with low back pain, and studying the effects of prenatal mental health support intervention. Reproductive health care is a top-level issue in any discussion of women's health care. I'm sure you're aware of the recent increased national dialogue in the U.S. about reproductive health care caused by the Supreme Court's decision on abortion. But I will tell you that contraceptive health care has long been a focus within the Department of Defense, important to individuals in terms of family planning and to readiness. We recently commissioned the Women's Reproductive Health Survey, the first of its kind to ask active duty servicewomen about their reproductive health care preferences, opinions, and needs, and about their experiences in getting access to this care. We are analyzing the findings to help us identify areas, both in policy and in process, where we are doing well and where opportunity exists for improvement. We are following the survey up with a new one that will solicit insight from healthcare professionals on their experiences in providing reproductive health care. Adding their perspective to the views of patients gained in the first survey will give us a richer understanding of the full range of opportunities and challenges. Walk-in contraceptive care clinics are being expanded to each of our military treatment facilities around the world, creating an environment for all service members to get contraceptive counseling and the full scope of non-surgical contraceptive methods in one visit without an appointment or a referral. Service members can discuss their options, whether their primary interest is pregnancy prevention or menstrual management. We have taken steps to better communicate with our beneficiaries as part of our efforts to address health equity. We rolled out 2 mobile apps designed to help servicewomen make health decisions. One is an app that leads users through a series of questions that provides instant contraception option information for comparison. The other addresses common questions and concerns about deployment, everything from menstrual management to injury prevention and intimate partner violence. Both apps are free and easily downloadable. Making sure our providers are trained in gender-specific care is important, and to that end, we offer mini residencies in musculoskeletal injuries and mental health care. Healthcare providers can maintain and strengthen their proficiencies in this specialized care. We work to make sure that women leaving the active force know about the full range of health services available to them as veterans. We have a Veterans Administration, Department of Defense, Women's Health Working Group that provides another important avenue of collaboration to support continuity of care through the entire military life cycle. One of the ways in which we serve the greater good of our nation is by sharing the research we do in military medicine with the entire medical community. There's no better example of this fact than the foundational science and research performed over the decades by the military research community enabled the accelerated development and implementation of the COVID-19 vaccines. This fact demonstrates the importance of military medical research for overall health. But we need to reinvest in research aimed specifically at women to address the gender differences in conditions like autoimmune diseases, cancer, infectious disease, and obesity. The return on this investment is a healthier, more ready force and a positive impact on recruitment and retention. I'd like to share some details from a few of our recent research efforts that have informed not only military medicine, but of a broader implications for entire population. A 2020 study of women's health care in the deployed setting examined the amount and types of gynecological and obstetric care providing during deployment and looking at the data through a socioeconomic and demographic lens. Ensuring pre-deployment contraceptive counseling was a key finding. Another recent study showed that the incidence of severe maternal morbidity is significantly lower in the population of women served by our military health system than in the U.S. population in general. Each pregnant woman in our system receives detailed information and resources at all stages of pregnancy. Many military treatment facilities provide family-focused, 2-week postpartum clinics recognizing the importance of postpartum care. Practice guidelines specify additional follow-up care for women with combat conditions at birth, particularly hypertension. The first U.S.-based study to examine birth outcomes between births attended by certified nurse midwives and physicians focused on births within the military health system. The study of more than 130,000 births showed that in the military health system, where certified nurse midwives have full practice authority and work to the full scope of authority, that they attended more than 3 times the number of births in the U.S. national average. The study demonstrated the good outcomes of these midwife-attended births and has significant implications for the civilian healthcare system. Moving to full practice authority for certified nurse midwives, which exists in our military system, would help address the severe national shortage of women's healthcare providers in our civilian system, where almost half of all U.S. counties have no OB/GYN. The results of the study can be used to implement evidence-based models of care and legislation to address the need nationwide. The contribution that military medicine can make to improving health equity for women is significant, and I'm proud of what we are doing in this area. We are always looking for ways to do more, to learn more, and to share what we've learned with the entire medical community nationally and globally. Once again, thank you for inviting me here today. I'll be all around all day if anyone wants to bend my ear. I love talking to people. Thank you for hosting me.